Welcome back to Nursing with Professor B. Today we will be discussing melanoma, some quick facts, things you should know if you're watching this for your nursing exam, or things you should know if you think you may have melanoma. Before we go, make sure you hit the like and subscribe button and you hit the notification bell. Let's go and watch it. Hello! Okay, today we're discussing melanoma. Let's get started. Quick facts about melanoma. It's the skin cancer with the highest mortality rate. It's important to differentiate that melanoma is not the most common cancer, but it has the highest mortality rate. The most common cancer is basal cell carcinoma. Melanoma is deadly because it may metastasize to any organ. That means it may spread anywhere. Treatment of melanoma usually requires biopsy and surgical excision. So we have to take a little sample of it and get rid of it, right? We have to excise it, take it out. Identifying melanoma is as easy as ABC. A, we want to look for asymmetry. So as you can see here, and I'm going to go through each and every picture, if you were to fold this over itself, or if you were to put a mirror over it, this side is not going to match this side. And that's what we see with melanoma, that it is asymmetrical. You can find these pictures at the American Academy of Dermatology. Let's focus on asymmetry. As you can see, as previously explained, if I were to fold this over itself, it would not be symmetrical. Symmetrical is if I take a piece of paper, and I fold it over each other, notice how it's completely even. That is symmetry. So here on the left side, the mole is dark and it's slightly raised, whereas the right side is lighter in color and it's flat. Next, we will discuss border. Notice how the border here is irregular. It is not round, it is not defined. So melanoma may have borders that are vaguely defined, and growths with irregular, notched, or scalloped borders need to be examined by the doctor. As you can see in this example, the border is irregular. There seems to be little notches. That definitely needs to be examined by a healthcare provider. Next, we're going to color variation. So in this example, we see that it goes from really dark black almost to reddish brown. So multiple colors or uneven distribution of color, it may indicate cancer. Next, we have a large diameter. So as you can see, this is greater than 6 millimeters, and sometimes we use the tip of a pencil eraser as a good guidepost. So if it's larger than the tip of a pencil eraser, then it needs to get checked out by a healthcare provider. And lastly, evolution. Evolution means, has it been changing, right? This person knows their mole, this mole has been with them for forever. Is it growing larger? Is it changing in color? Has it changed at all? So look for changes over time, such as a mole that grows in size or that changes color or shape. Moles may also evolve to develop new signs and symptoms, such as new itchiness or bleeding. If they have a chronic mole that all of a sudden has started bleeding and it's not healing, that's a huge warning sign. So we definitely want a healthcare provider to take care of that, to take a look at it. So here are the ABCDEs of how to identify and recognize melanoma. You want to make sure you're checking for asymmetry. We see it here. The border is irregular, color variation, if the diameter is large, and if it has been changing. Thank you so much for watching. Make sure you hit the like and subscribe button and you hit the notification bell.